Hello everyone. So now we are going to discuss another topic of neonatology, that is necrotizing enterocolitis. As the word indicates, necrotizing means ischemic damage, and enterocolitis means colon is involved. Ischemic damage of colon or GIT is known as necrotizing enterocolitis. Now, the definition of necrotizing enterocolitis is uh, ischemic damage or intestinal tissue becomes damaged and dies, that is known as necrotizing enterocolitis. Epidemiology, it is most common surgical condition and most frequently occurs in preterm. Now, why it occurs most commonly in preterm? So preterm are the babies who are given birth before 37 week of gestation, and they are more prone to develop birth asphyxia. When they develop birth asphyxia, these babies will have lack oxygen supply to the organs like brain and gut or GIT. So when GIT is impaired with oxygen supply, so its the tissue can be damaged and develop baby can develop necrotizing enterocolitis. So in this way, this occurs necrotizing enterocolitis in preterm baby are given birth before 37 week of gestation, and then they develop birth asphyxia. In birth asphyxia, there is lack of oxygen supply to the GIT, and ischemic damage of GIT occurs, and necrotizing enterocolitis will be there in the babies. So this is pathophysiology behind development of necrotizing enterocolitis. Now, clinical features will be distended abdomen. Baby's abdomen will be distended because lack of peristalsis and lack of ganglions in the GIT. There will be blood in the stool. Metabolic acidosis will be in the babies, and lack of energy and vomiting will be there. So these are clinical features of necrotizing enterocolitis. Now, how can we diagnose this condition? For diagnosis, we will have to perform X-ray abdomen. Now, as you can see in this picture, this is X-ray abdomen, and here in X-ray it is shown that there are multiple air fluid levels. As you can see here, these are air fluid levels in the abdomen of the X-ray abdomen of the baby. So why these are multiple air fluid level? Because there is uh, necrosis of ganglion occurs and abdomen is distended. In distended abdomen there is fluid as well as air. Now when this X-ray is performed, air comes upward and fluid goes downward. So this X-ray will show multiple air fluid levels. So in this way we can uh, diagnose the condition of necrotizing enterocolitis through abdominal X-ray. Now other investigations will be we will see the multiple air fluid levels in thickened bowel wall with a pneumatosis intestinalis, means air in abdominal wall. So that is known as pneumatosis intestinalis, and on plain abdominal film, and pneumoperitoneum will be there because of perforation of uh, gut. Pneumoperitoneum can also develop, and air under diaphragm can also be observed in the X-ray. Now, how can we manage the condition of necrotizing enterocolitis? We can manage it medically by keeping the patient with nothing per oral NPO. We will not give anything to the baby through oral route, but we have to maintain nutrition through NG tube, and total parental nutrition through IV fluids can be given in the baby. IV analgesics as well given as well, and treatment should be thrombocytopenic. Uh, Treatment of thrombocytopenia and anemia and DIC should be performed in the babies. So in this way, and the final treatment is surgical management with exploratory laparotomy with resection of necrotic bowel segment. Let's suppose if this is normal bowel after intestine, after stomach, small intestine is normal, but large intestine, the portion of large intestine is necrosed. So this portion should be cut, resected, and corrected. So in this way we can correct surgically the condition of necrotizing enterocolitis. Now what can be complications of this condition? Intestinal obstruction or adhesion and structures can be formed, and nutritional deficiencies can be there in the babies, because when part of intestine is resected, there will be malabsorption, and nutritional deficiencies occurs because of malabsorption and shortcut syndrome, and baby can also develop cholestasis. So in this way necrotizing enterocolitis can be treated. It is a condition, as we discussed, when part of colon or GIT is necrosed because of impaired oxygen supply. So this is the necrotizing enterocolitis.